Thank you very much. I do hope you can hear me and also see my presentation here. Please let me know if not. Right, my task today is to discuss some of the lessons of managing the last 18 months or so of crisis and emergency in terms of what this means for future emergency planning and management, and perhaps also risk management. Let's remember that pandemics are a recurrent factor in human history and they do need to be planned for. Non-seasonal influenza, for example, recurs approximately every 35 to 40 years with varying degrees of impact. But like other viral infections, it does require planning in order to cope with it. The trouble with this, of course, is that with emerging diseases, new variants or new kinds of virus, we simply do not have the knowledge that we need to manage precisely the situation as it develops. We therefore have to use adaptive management that will enable us to change our strategy as we learn about the behavior of the virus and how it interacts with human populations and their behaviors. This involves a considerable number of uncertainties. Let's consider some of the theoretical aspects behind emergency planning of the current pandemic as a disaster. It is undeniably a disaster with 3 million, nearly 4 million dead worldwide. It is also, like all large impacts, a cascading event with chains and networks of consequences in different fields. Cascades involve a primary cause, in this case the virus, which will lead to a series of impacts in a variety of different sectors on the economy, on infrastructure, on housing, on human relations, on productive capacity, on entertainment, on many different things. So these need to be taken into account in our planning scenario. And of course, there are many aspects to managing a viral pandemic. These are some of them, but they are completely interconnected, which emphasizes the role of the cascade. So really, we cannot afford to ignore any of these aspects: psychological, social, economic, medical, epidemiological, and so on, logistical, etc. We therefore need rather intense and rather complex emergency planning, not to say management. So these then are some of the processes involved, but what is important here is to be able to connect up these processes and to evaluate the effect, for example, of policing on productive activities, on social relations, on psychological factors in the population, to examine the effect of epidemiology on these other factors as well, for example. So a connected approach is essential. Now, the point about cascades is not merely that we have, as in diagram A, potential chain of knock-on effects, or as in diagram B, a possible network of knock-on effects where one thing leads to another. But a defining feature of cascades is escalation points. Now, what do we mean by this? The interaction of different kinds of vulnerability, medical and social, psychological, economic, and so on, may cause escalation of the problem such that the secondary impacts are very serious and generate further impacts. Here are some simple examples of escalation. In March 2020, after the start of the pandemic, the British government allowed the Cheltenham Festival to go ahead with 60,000 people congregating with no social distancing and no masks. This was clearly a factor in escalating the disease. In a variety of countries, relaxation of distancing measures and control measures over the summer of 2020 in favor of the travel and hospitality industries led to a complex form of escalation that began in September and carried on into the Northern Hemisphere winter. If we want to understand, however, how people, society, communities are vulnerable to a particular hazard, such as COVID-19, or indeed any pandemic or any disaster, there we would be looking at specific vulnerability. But one important message is that we cannot understand that without knowledge of general vulnerability. In other words, you cannot make people safe against a single hazard if they're not safe against hazards in general. So we need to consider how people are vulnerable, not merely in a specific sense of vulnerability to earthquakes or floods or a viral pandemic, but how they're vulnerable in general terms regarding things like poverty, regarding things like homelessness, and the many different risks that we run in modern life. Now, what that actually means is that in something like a pandemic or other major disasters, the most vulnerable people have an exceptionally high sensitivity to political decision-making. In other words, the decisions that are made have profound consequences. This is a picture of Oldham, Lancashire, northwest England, which is perhaps the worst affected place in the United Kingdom regarding COVID. And it's very, very sensitive to the decisions made by the national government about managing the pandemic. And that is because people have fewer reserves compared to more prosperous regions. And they therefore feel the impact of not only the pandemic, but the decisions very directly. Let's consider the realities of COVID and what they tell us about emergency planning needs. First and foremost, in many places, emergency planning has been ignored, marginalized, or underfunded, and perhaps all three. And that is not a good situation because, in fact, it is a profession and it does require a seat at the table because it is key to the management of a viral pandemic or indeed any large crisis or emergency. In the case of marginalizing emergency planning, what then happens is that medical scientists and politicians become the decision makers, the planners and the managers for risk and for disaster, but they are not suited to such roles. The scientists may understand the disease, the politicians may understand the political reality, but they do not necessarily understand the logistics and the consequences of management decisions. And whereas the scientific answers may be enormously complex, in planning terms, they boil down to decisions that require a simple yes or no, do we or don't we? And that is very difficult to connect with the complexities of the science of a disease like COVID. So what did we find was done? Well, countries retreated behind their own borders, and they therefore tended to ignore the lessons of the previous major SARS outbreak in 2003, which was stopped essentially by international collaboration. And much of that was needed in the early stages, and of course is still needed in the later stages of COVID-19. Marginalization of international organizations, particularly under Donald Trump's administration in the United States, did not contribute well to that process. Moreover, there was a reluctance to move, particularly because of the economic consequences of things like lockdown and restrictions. And that lost an opportunity to react quickly to the disease. But we did know many things. After SARS-1, 2002 to 2004, a period of intense study began that extended from 2003 to 2009, in which the full scenario for a viral pandemic was put together, and that was extremely useful in planning terms. Indeed, from 2005 until 2013, when it was eclipsed by other things, there was a period of fairly intense worldwide emergency planning for a pandemic. In the United Kingdom, pandemics remained at the top of the list of potential future emergencies, the most important among 94 separate risks, and yet they were not adequately planned for. Now, of course, there were things we did not know about a future pandemic, how many waves, for example, the details of the virus in question, and so on. But we did know some very important key factors. For example, that there would be serious impacts upon care homes, which are, of course, sources of great vulnerability and require particular planning strategies to look after them. And yet, sadly, in a number of countries, leadership has been arrogant, denialist, ignorant, indecisive, erratic, negligent, or exploitative. And furthermore, it is estimated that 88 countries have used the pandemic as a pretext for curtailing human rights to a greater or lesser extent. One thing you need in disasters is good human rights. They guarantee access to information. They help promote a participatory approach, which is exactly what we need, and many other things. So what did we need? Well, we needed careful evaluation of not merely the medical information, the virological, epidemiological information, but also the economic, the behavioral, the psychological, the logistical, above all, the logistical information that was coming in. We needed the approach to be local. In all disasters, the local area is the theatre of operations, no matter how large the event. Coordinated and harmonized regionally and nationally. If that system did not exist or was not complete, then the response would be less than optimal. We needed communication with the public and with specific entities, organizations that was clear, consistent, honest, frequent, and did not involve sudden U-turns. Yes, we had to adapt the strategy. All of us have had to adapt our behavior, our decisions, and those who work in productive industries have had to adapt their investment strategies to constant change. However, this needs to be communicated in a way that is consistent, even when change is required at short notice. We needed to react quickly to the signs, particularly where they emerged in other countries, with the knowledge that they would soon spread to one's own jurisdiction. We needed to impose strong measures quickly in order to react to the diseases, and those countries that did that in a systematic way fared best. We needed to create, maintain, and project our scenarios for planning purposes. A scenario is a learning process. It is an exploratory process. It is not a prediction of the future. It is an examination of possible future outcomes. And it is absolutely vital to something like COVID-19. We needed a good integral civil protection system based on a functioning law that would tell us how the system is specified, how it works, what the essential responsibilities within it are, and how it will tackle emergencies. And we need that to be connected to a strong local capacity with connected up government that will enable all ministries to help participate in the process of managing things as they emerged and developed locally. In this, welfare is essential. Now, politicians are reluctant to define welfare, but define it they must, because people need support. Those who cannot work will need support. Those whose employment is at risk will need protection. And there are many other ways in which welfare is essential to the maintenance of society in a major crisis. So there are problems of equity. We see this at the global scale, where the super rich have become considerably richer and the super poor have become substantially poorer during COVID, and that should not have happened. Welfare also helps stop unrest, which may develop as a result of people's desperation. Communication, as I mentioned, is absolutely vital. It must be consistent and correct, honest, with messages that are frequent, timely, reliable, and that inculcate trust in the population. Trust between the message givers and the message receivers is absolutely essential. And in that context, major figures who do the communicating must act as role models. Their behavior must be impeccable and visibly so to the population if trust is to be maintained. And trust is very precious in this. A quick word about vaccination and recovery. Now, as you see from this diagram, the creation very rapidly of a vaccine against a viral disease is a complex process with a number of places where it can easily go wrong and a large number of steps to it that need to be managed and integrated with each other. Vaccines are not normal commodities. We therefore cannot consider the manufacture of them as similar to the manufacture of motor cars or broom handles or anything else. Great skill, great technological input are required. Normal manufacturing times have to be compressed, and of course, so do approval times for new vaccines that are created. And of course, during that process, the virus may continue to mutate, calling into question the validity of the vaccines. On the other hand, some things that are a problem in normal vaccine production are not a problem during a pandemic. There is limitless demand, so there's no question over batch sizing as much vaccine as possible. Shelf life doesn't matter. You can sell and you can distribute your vaccines as quickly as you can. Cost benefit assessment is not terribly relevant because in fact, governments are willing to pay for vaccines, and that is the end of that story. However, there are things that can go wrong. For example, this is a list of about 7 things that potentially can foul up, which will, of course, reduce the supply of vaccines and slow down the vaccination process, which is absolutely key to the recovery of populations against the disease and to the restoration of some kind of new normality. So we therefore require adaptive management to ensure that we can cope with any of these things that happen. What about recovery? Well, of course, in something like a viral pandemic, we're not dealing so much with damage and rebuilding and so on, although we are dealing with rebuilding the economy, and we're most certainly dealing with socio-psychological recovery. We also have to work out how to plan for and manage the intersection of different kinds of disasters. Japan, like Croatia, Turkey, and Greece, has had an earthquake during the pandemic. Now, in most kinds of emergency response, we require to associate very closely in physical terms. And yet we require distancing during a pandemic. It is no easy thing to manage other kinds of disaster when all resources are pouring into managing the pandemic. We now need serious scenarios for the recovery process, which is still rather opaque. Yes, we had the scenarios for a pandemic as long ago as 10 to 12 years ago, but we did not, unfortunately, have clear scenarios for the recovery. And these we now need to develop in order to plan it, bearing in mind that there will be new patterns of working and living. There perhaps will be adaptations and changes that remain permanent or semi-permanent in social relations. There may well be an epidemic of psychological problems, of mental health problems. There will be an altered balance between work and home. And there will be different needs to safeguard environments, not merely against physical problems such as terrorist attacks or earthquakes, but also against future pandemics, because of course this is not the last one. So we require to simulate, to plan, to create the scenarios and test them, above all to stress test them. We require to be able to create for future pandemics a test, trace, isolate and support system, which is very expensive and reaches well into all aspects of society. We require to be able, if we cannot stockpile equipment and supplies, to have the kind of agreement where we can manufacture them very quickly, personal protective equipment, ventilators, and of course the medicines and vaccines, antivirals and so on. We require the ability to react to massive changes in economy, society, and the psychological health of the population, and to do so using instruments connected with welfare, taxation, and physical, mental, economic support to sectors of the population that most need it. Conclusions. 10 major lessons. Firstly, planning is essential because pandemics are recurrent, actually not merely viral pandemics, but other diseases too. If you look back at human history, pandemics have occurred again and again and again, and they will continue to do so. Global connectedness will facilitate that process. When pandemics occur, we need to observe and react to situations in other countries, and we need to do that for other forms of disaster as well. For example, cyber attack. We need to take on board global lessons or lessons in other countries in our planning process. We need to react very promptly and decisively to pandemics or indeed any other disaster. We need a good, integral, complete civil protection system based upon the local level, harmonized, coordinated, regionally, harmonized nationally. We need to decentralize the approach in order to ensure that we have the resources, the know-how, the knowledge, and the ability to react locally, because simply we cannot draft in enough resources when they are needed locally. We need to define who are the key workers. They're not merely medical workers such as doctors and nurses. They're also those who work in transportation and distribution of goods or in supermarkets, and we need to protect them. We need to ensure that there is a seat at the key tables for situation management, for future projection of planning and so on, for the emergency planners, the risk managers, the emergency managers. We need to make sure that communication will take place in a proper manner and that communicators will be good role models. We need to have a comprehensive idea of welfare and how it will support those in need. And we need to pre-plan not merely vaccination, but recovery. We can do it. So my take-home message is that emergency planning and management, and perhaps also risk management, hold the key to the control of pandemics and indeed other forms of disaster too. They will enable us to identify needs in time to be able to satisfy them. Improvisation kills people in situations like this. Now, we cannot eliminate improvisation, but we need to reduce it to the lowest possible level because it's inefficient and people die as a result of inefficiency. We need to involve the public so that they are protagonists, and that essentially means communicating well with them. So the whole idea of emergency planning is to have a clear, well thought out and precise strategy, and one that involves adaptive management, enabling the managers and the planners to adapt to fast changing, radically changing situations. I've endeavored to put together some of this in a report which you can download from my institute's website for free, and it codifies at least some of the early and midterm lessons from the pandemic in terms of how to improve our emergency planning processes for the future. Thank you very much for listening.